Jackpot syndrome in your hospital.
Yes, it's affecting all of us. We have to go back to the roots of all this.
Absolutely.
This is not something about 5 years ago, 10 years ago. It actually started back about 4 decades ago.
Right.
In the 80s.
And so back in the day, you jackpot, and then now you're back.
You're
back to the
country.
Right?
So I left Nigeria as an engineer. I did not do medicine in Nigeria.
Wow.
Interesting.
Yes.
So what happened?
It was when I got to the United States, the opportunity presented itself, and then I ventured into medicine.
Wow.
All right, so let's go back to 4 decades ago when this began.
Yes, 4 decades ago, if we all remember, Nigerian doctors were the one that established Saudi Arabia healthcare system.
Right.
What did that leave us with? They drained our experts, and we never filled that vacuum. So what we're seeing now is cascading effects of that 4 decades ago. The Nigerian professors went to Saudi Arabia for greener pastures. A lot of them gave the excuse that it was for their family, better conditions. The Nigerian government never paid attention to that. And so now what we're seeing is actually more than the symptoms of what they did. They left our academic institutions. We could not fill that up. Our training institutions now, we are considered a medical desert.
Right.
We currently have more medical Nigerians living abroad than at home. Our current healthcare minister said we are left with 55,000 doctors.
Wow.
For a country of over 200 million.
Yeah, speaking of data, the NMA actually said now 24,000 doctors for over 200 million people. That's a doctor-to-patient ratio, which is far below the WHO recommendation.
Right.
And we have 11,000 Nigerian doctors registered in the UK that are working under General Medical Council. But how do you consider the impact, the long-term and the short-term impact? Or let's say short-term and then long-term impact of this mass exodus of these medical practitioners?
So the short term and the long term seems to be the same. We're dying. We're losing people. You go to the emergency room, the waiting time is just ridiculous. Our healthcare infrastructures are just devoid of the appropriate equipment. Our healthcare workers, the very few that are left, they're overworked. It's like you put them to the war front and you tie their hands. So who pays the price? We, the masses that go that end up in the general hospitals, pay the price. I get patients now that tell me they want to see a specialist and they're giving them 6 months, 9 months waiting period.
In Nigeria?
In Nigeria. In Lagos especially.
Something that needs urgency to
Honestly.
Of attention.
So let's look at how we have, as a country, tried to address the gaps that you mentioned over the years, both in our institutions and in the hospitals. We have seen strikes several times. We have seen doctors come to talk about their welfare not being anything to write about. And then we have seen recently a Proco doctor put out a video looking at the state of a primary health care. It's not something words can really describe as it is. Now, the condition on which they work is also a major challenge. Talk to us about government efforts, the various levels, subnational and the federal.
Good. About 10 years ago, 2015, the Nigerian government, in collaboration with stakeholders, investors, actually came up with a plan that how can we address this. Granted, they are 3 decades late, but let's look at what they've done. What they're trying to address is just the symptom rather than look at the roots of what happened. Everybody blamed the doctors and said they're traveling for greener pastures. Look, the grass can be greener anywhere. We just need to provide the nutrients. Are we giving them the right incentives to stay home? Because a lot of the doctors, my colleagues, will tell you, look, it's for my kids. The school system are better. So now it's not even medical. They're looking at other things because as parents, they want to make sure that their kids have better future, their kids go to good schools, the schools are not on strike, and it's overwhelming to them. Yes, at the burden end, we look, oh, they go there for better prices, but they actually go for their own professional improvement. If you go to the US, the incentives you have, we cannot be comparing that. But we can do a lot here. Because these Nigerian doctors who are thriving over there, look, what is the difference? If you incentivize them, they can do the same thing back home.
So